Hi everyone, today we are going to see about the respiratory syncytial virus. So this respiratory syncytial virus is a pleomorphic virus. The pleomorphic means it's changed their shape. So this RSV will be ranges from the size from 150 to 300 nm. And also RSV is an RNA virus. So basically the virus is divided into two categories. One is DNA virus, another one is RNA virus. And here this RSV will be coming under the RNA virus, which encodes the 10 types of protein in their body parts. Example, fusion protein, nucleoprotein and passport protein. So this RSV also placed in the separate genus is called as pneumovirus. So Syntium, the name is called as respiratory syncytial virus, right? So what is that syncytial? Syntium, multinucleate mass of protoplasm produced by the merging of the neighboring cells. That is, the virus protoplasm will be merged together and it will cause the multinucleate mass. So that is called as Syntium. That's why the name is called as respiratory syncytial virus. So this RSV is a common respiratory virus like coronavirus, influenza virus, and it will affect the lungs and bronchioles. So bronchiole means is a smaller waves that carry the airs to the lungs, and also it will affect the childhood. It will causes the illness by the age of 2 years of age, and also it will affect the adults by the age of above 60. And this RSV is also identified in victims of the sudden infant death syndrome. And if it is, there will be a severe infection of RSV will leads to pneumonia and bronchiolitis. So pneumonia means an infection in the lungs. Bronchiolitis means the inflammation of the small airways in the lungs. And also this RSV will affect the nasopharynx and lower respiratory tract involvement. And RSV will affect the cattle and chimpanzees, especially goats and sheep will also be affected naturally. So transmission, this RSV is a highly contagious virus. What is highly contagious means? It is easily spread from one person to another person. So the infection is easily spread in young children because of their close contact with the other children who may be infected. The symptoms also generally last from 3 to 7 days. So what are the risk factors? Who all will easily affected by this RSV means premature infants because their lungs will be underdeveloped, and then infants under the age of 6 months, and infants born with heart or lung diseases, and children and adults with having the weakened immune system, and also who are receiving the organ transplantation or otherwise undergoing the chemotherapy. So adults, it will be a 65 years of age and older. So adults, if they are having the heart and lung diseases such as congestive heart failure, chronic obstructive pulmonary disease or asthma. So symptoms. So what are the symptoms of this respiratory syncytial viruses? Running nose, decrease in appetite, sneezing and coughing. So fever is there, it will be in higher degrees. Fussiness, irritability, decreased in activity, that is more tired than unusual, and short, shallow and rapid breathing, and they also having the bluish coloring of lips, mouths and fingernails. So what are the diseases and what are the clinical manifestation is bronchiolitis, and then reinfection is always common in adults, and also having the congenital heart disease, bronchopulmonary dyspnea defects. So those who are the immunosuppressed or immunodeficient, and sometimes this infection will lead to the chronic respiratory tract disease, asthma and bronchitis. So how we are identify this RSV in laboratory diagnosis? It's viral detection and isolation. blood count, serological test, immunofluorescence, enzyme immunoassays, X-rays, CT scan and molecular methods. So treatment is a supportive management, the tube feeding because difficulty in sucking of the baby, and then use of the oxygen through the ventilator, and there will be an especially for the specific antiviral drug is for RSV, that is the ribavirin. So how we can prevent this RSV is we need to avoid the close contact with the sick people, clean and disinfect surfaces, and always clean the hands of the children. Thank you.